glad you guys could make it today. My name is Heyde Ramirez. I am a board certified behavior analyst. I have my master's in applied behavior analysis. I am licensed in the state of New York to practice ABA. I've been in this field, working particularly in the field of autism with little kids, teenagers, adults, all individuals on the spectrum for about 10 years now. I started out as a one-to-one para, working in the schools. I also did some work in the day habs where it's mostly the adults and helping them transition into finding jobs and, what do they really want to get out of life at that point. And sometimes with the teenagers, some teenagers, some of the guys you may be working with, suddenly they're interested in girls, there's so many different things that we do. And at this point, for the most part, I've been doing insurance work like many of you guys, I'm assuming, also do. And so today we're here for a training on ABA methodology. Now, some of this may be old news to you. I know that there was another training recently that talked about this sort of thing. So we're not going to be going really into the details like that other training did. This is going to be more of an overview where I really want to get feedback from you guys. Where at all possible, I want this to be a discussion. I want you guys to tell me, oh yeah, when I'm in a session, I see that, or, I'm confused about this. And well, you'll see as we go through where we can have those kind of discussions. So please feel free to speak up. This is really important for you guys. You're here for this training. Hopefully you get something out of it. And feel free to speak up. Move around once the lights dim. If you can't really see and another seat might be better for you, feel free to move around a bit. All right. So today's training, our objectives are going to be to, again, increase your knowledge of these basic concepts in applied behavior analysis. We're going to be talking about, obviously, behavior. That's the big thing. We're also going to be talking about the environment. How does that affect behavior? We're going to touch a little bit, and I mean it just a little bit, on respondent behavior. Operant behavior, that's a big deal from what we do. And also reinforcement. That's like your go-to thing when you're working with the kids, what's the right reinforcer? Is it working? And also promoting generalization and maintenance of behavior change. So great, you taught Johnny how to say cat when he sees a picture of a cat, but when you guys went to the pet store, he couldn't identify that animal, so it didn't generalize. So these kinds of things are very important. And then at the end, we're going to have a small portion of this is going to be on data collection. You guys are there. You guys are taking data. To the point, more about the catalyst data collection, which if you're working with applied, that's the data collection that you guys are using. It's on the iPad or on your phone, and you guys need to know how to maneuver around that, how to log in. If you guys are having any problems, that's also where I want you guys to tell me, hey, this is the part where I'm confused. Of course, you can always talk here to your BCBAs, you can always call in here, but this is a good chance for us just to, have a conversation about these things. So just jumping right in, behavior can be overt, it can be covert. It's what people say and do. It has one or more dimensions. It can be observed. We can describe it. We can record it. It has an impact on the environment. It's lawful. And we're going to go into what all these things mean in just a few seconds. So when I say that behavior is overt, I mean that you can see it. If I start hitting somebody, you can see that. If even me just walking, you can see that. Me talking, anything a verb that I can do, you guys can be like, oh, she's doing that right now. I can see what you guys are doing. Even sitting, it's something that you're doing. But then there's also covert behaviors. Behaviors that, they're private. I can't tell what you're thinking. If your BCBA tells you, okay, I want you to take data on every time he thinks he can't do it, how are you going to take data on that? You don't know what your client is thinking. You might be able to take data on an overt behavior, maybe when he says, oh, I can't do this. So behavior is what people say and do. We were talking about how it's covert, it's overt. Well, when you guys are working with your clients, we're not so much concerned with those behaviors that we can't observe. They exist. We're not going to say they don't matter, but in terms of the programs that we're working on, the behavior change, we want to see behavior change primarily with those behaviors that are clear for other people to see. Behavior that's observable has a very clear beginning and end. So if I say to you, well, Jane is sad, How do you know when Jane's sadness began? How do you know when it ended? But if you give me a very clear, Jane is crying, I can actually take a look at Jane crying and say, okay, it started at 8:01, it ended at 8:03. But it gets very vague when you just, oh, when is Jane sad? I may have a different definition of what sad is than you do. And everyone needs to be able to agree. Everyone going into work with that child needs to know, okay, we're seeing what we say we're seeing. Jane is crying. You can't say, oh no, Jane wasn't crying. No, we have a clear definition when tears are coming down the face or when she's making a certain noise. That's what we call Jane crying. We want to, let's say, decrease Jane's crying. Then, we can figure out ways to do that, but we always need to have that starting point. What is the behavior we're looking at? So the definition of behaviors is very, very important. So if you look at your slide of what behaviors, what people say and do, I put there, John kicked his mom, threw his cup of juice at his younger brother and stomped his feet. That's a lot more descriptive and useful than saying John was being disruptive. You need to have all this information. Keep this in mind if your BCBA tells you, fill out an ABC sheet. What was the behavior? If I go to a house and a parent says to me, oh, my child is being so disruptive. And I'm like, but what exactly do you mean? What are they doing exactly? Are they kicking? Are they pulling someone's hair? What is it? Because if, let's say, you tell me being disruptive, that may mean something completely different to me. I may look at that child and be like, that's not disruptive. They're just upset. Or they want a toy. You want to be very clear. Behavior has one or more dimensions. You can measure the frequency. Let's go back to Sally, let's say, kicking. You can count how many times Sally flexed her leg outward and kicked. You can count that. You can also measure the magnitude. If you have a student who you want them to be able to, let's say, lift a 10-pound dumbbell, for whatever reason that's the goal that this child has, you can say, well, they're able to lift 1 pound, 2 pounds, 3 pounds. That's the magnitude. And you can also measure duration. How long were they able to go on that exercise bike for? We have some students that are very overweight, and that might be something that you guys want to work on, increasing the amount of time that they're able to engage in exercise. Sometimes it makes a lot more sense to pick one of these dimensions over another when you're going to be taking data. If mom says to me, no, let's say the therapist says to me, oh, the frequency of biting, of screaming has decreased. And the therapist is really happy and telling me, and I'm happy because I'm looking at the data and I'm like, oh, okay, so this student used to scream 20 times a day. Now they only scream 3 times a day. And then I go to the house and I'm going to speak with mom and I'm going to tell mom, this is great. The frequency of the screaming has decreased. And then the parent looks at me and they're like, what? I've been having the most horrible time. And I'm like, what are you talking about? Well, sure, he only screams twice a day, but the screams last like 30 minutes. It doesn't stop. And that's when you might be thinking, oh, maybe I should have been taking duration data instead. Because that's what's important. How long was it lasting? Instead of how many times it happened. Your data can get very skewed if you're not looking at the right dimension. For example, let's say you have that child who really wants to get fit and you're going to take data on how many times they can lift a dumbbell and you say 1 time, but you don't take note of how many pounds it was. If a teenager, let's say, can lift a 20-pound dumbbell twice, you could argue that that's better than that same child lifting a 2-pound dumbbell 10 times. And again, it depends what's the goal here. What do they want to get out of this? But it's just something to keep in mind. If you're taking data on something and your BCBA is telling you, yes, take data on this, but you start to notice, because you guys are the ones in the home. If you start to notice, oh, but there might be another aspect of this behavior that's really important. Mom keeps mentioning how it's the duration or it's the magnitude. They scream really loud, as opposed to, just like these little tiny screams. Then you might want to bring that up to your BCBA, to your supervisor. It's really important for you guys to have open communication because you guys are the ones in the home. We come, we make our visits, and, you know, we have our schooling. I have my master's degree. I have, you know, I go to all these trainings myself. But you guys are the ones in the home actually working with the child. You are the ones that if I were to say to you, oh, I want you to use this prompt, and all of a sudden I notice you kind of look at me kind of funny, and I'm like, wait, why are you looking at me like that? You're like, I don't think that's going to work. And I might say to you, well, no, you know, there's all this science behind this, you know, do it this way. But there might be a reason that you're telling me, no, this isn't going to work. Maybe you know that if it's a hand-over-hand prompt, you might have noticed in the past, oh, whenever I go and put my hands over his hands, that really upsets him. I may not know that. I may just be thinking, oh, you know, hand over hand prompt, and then we'll fade it out, where you know, when I've been working with him, I always use gestural, and that works. You need to tell me that. And I'm going to take what you say into consideration, because again, you guys are the ones there. You have to have that open communication with your supervisor, because as much as they know, you know a lot too. You're the ones working with the kids. So, you know, it's a back and forth. You guys are a team, and that's really important for you guys to know. So, you know, just going back to what I was saying before, behavior can be observed, it can be described, it can be recorded. It's an action. We want to be talking about these behaviors with verbs, not adjectives. So you want to have a clear operational definition. Is there one set definition for something like aggression, elopement? No, that it's really goes case by case, and they can be tailored to the situation. Aggression for Sally could be hitting with a closed fist, whereas aggression for Billy can be throwing objects at the therapist. So if I come into the situation and I believe, well, aggression is hitting, right? And that's what I'm going to take data on. And maybe I'm not taking into consideration when he curses out his mother. I'm like, well, that's not really aggression. That's not what I'm going to count. Maybe I need to count that. Because if I write on the behavior on the progress report and the therapist is telling, no, there's no aggression, because everyone's looking at aggression as hitting, then I'm not really doing a service to this child, because there is still aggression going on. We might need to expand our definition to include verbal aggression, to include cursing, to include kicking, and all these other things. You know, and is your definition realistic? If your BCBA tells you, here is the treatment plan. When Billy throws an object at the therapist, you are going to, let's just say, have Billy go pick it up, the object that was thrown, and return back to the table to continue working, right? And it's very clear. When Billy throws an object, you represent the work, and Billy needs to pick up whatever was thrown. And, you know, you worked on that. You've been trained on that. But all of a sudden now, Billy didn't throw an object. Billy scratched you. Do you do the same thing? If Billy's never scratched you before, you may not know in that situation. What do you do? I mean, you've always been in a situation where Billy's thrown things at you. And that's what the BCBA has accounted for. All of a sudden, you get this new behavior in the mix. You know, that might be something you want to bring up to your supervisor. Hey, what if this happens? What should I do? But let's just say you guys haven't talked about that yet. You may want to then say, well, you know what? The topography is kind of the same. I still got hurt. You know, whether something was thrown at me or I got scratched, I still got hurt. Let me deal with it the same way. And for that moment, handle it the same way. However, be sure that you then either you write a note in Catalyst or you call up your BCBA or however you guys communicate, but let them know, because that might be important. For all you know, scratching is happening for a whole different reason that you may not be aware of. So you want to bring this up to your BCBA. You want your BCBA to be like, oh, something else is happening? Let me go take data. Let me go talk to the parents. Let me do whatever needs to be done. And, you know, behavior has an impact on the environment. Behavior is an action that involves movement through space and time. That's like a quote that we always, you know, tell people. It's not happening in a vacuum of space. You know, me being here, it's affecting, you know, everything. Even something as simple as, you know, me talking, you know, the oxygen levels are changing in here. Everything has an impact. Like, you know, something as simple as you cough and someone says, bless you, or you turn the faucet and water comes on, Or you recite a phone number to yourself, and now the next time you're able to dial it correctly. That's an effect on yourself when you study and things like that. Behavior is lawful, and I can't stress this enough. No one does anything for no reason. What we do has a purpose. So when you see your client is there and they're screaming, or they're making themselves throw up. And yes, I've worked with some kids that they'll make themselves throw up. It's for a reason. We may not understand just in the immediate moment, why are they doing that? But there are ways to figure it out. There's assessments that your supervisor can do to figure out, oh, okay, so every time you present work, he makes himself throw up, and typically then work gets removed because now everybody needs to clean the throw up. Who wants to work when there's throw up around? So that works for that child to make work go away. So there's always a reason. So I'm just gonna go over a little bit of, we have reasons such as to obtain a tangible. I want something. Let me put it to you this way. Well, before I go into that. So I want a tangible, I want something. I want to get away from something, whether it's work, whether it's you, whether it's a situation, but I want to get away. I want to either avoid or get out of the situation I'm in. Then there is, this feels good, sensory. So I twirl my hair, or, I'm humming to myself. No one's around telling me, good job humming, but I like it, so I'm humming, right? And you also want to rule out medical. If all of a sudden your client starts throwing up, don't immediately think, oh, that's because he doesn't want to work. Maybe ask the parent, was there a virus going around? Because you never know. You want to rule out medical reasons first. And let's see, what's the other one that I know I'm forgetting one? There is, for attention. How could I forget that? So many of the things that we do for attention. But let me tell you something. When you're working with a child, and you might think to yourself, why don't they just say I want a break? Isn't that so much easier than throwing things on the floor and doing all these things? Isn't it so much easier to just say I want a break? It might not be for these kids. It might not be the history of that they have, that when they say I need a break, someone says, okay, sure, take a break. You don't have to do the work. A lot of times when someone will say I need a break, an adult will likely say, no, a little bit more. You can do it. So, but if you start screaming and you don't stop screaming, an adult is more likely to then say, oh, okay, we'll try this again later. Just calm down. It's okay. This is too hard? Okay, we'll do it later. Or I'll help you, or this or that. So you keep that in mind when you're working with your clients. We do what works. And when all of a sudden it doesn't work, sometimes we get upset. So if you're working with a child that has always, that their entire life they've known that if they take a toy from their sibling and the sibling wants it back, if they don't have to give it to them because they're going to scream because they really want the toy, and then mom's just going to be like, no, you can have it. I'll find something else for the other sibling. And that's always worked. Then they're going to keep doing that. We need to teach them, though, no, there are better ways. Use your words. And we keep saying that, teach the child to use their words. And it sounds very, almost common sense. Oh, tell the child to say, I want a break, rather than hitting. Or tell the child to say, I want food, rather than stealing something off somebody else's plate. But we need to be the ones to set the scenario for that. We need to follow through so that every time that Sally says, I need a break, you're like, yes, sure, here's your break. I'm glad you used your words. Is that realistic though? Are you always going to give Sally a break? No, that's not how the real world works. But initially, yes, we're going to give Sally a break, because what was happening before? She was always getting a break anyway when she was kicking and screaming anyway. So we need to decide, what do we want to reinforce? Is it the verbal behavior that we want, or the maladaptive behavior that we don't? And it's difficult. It can be very, very difficult, especially for parents, especially for someone who's new to the situation. When a child all of a sudden, or a client, is screaming or is doing something really, that you're not expecting. for you to sit back and say, no, but the reason they're doing this is because they want this. I need to show them the right way, that this way doesn't work anymore. So if a child is used to trying to bite you to get out of doing work, and you keep the work there, what do you think is going to happen? They're just going to immediately realize biting does not work. Let me now use my words and say, can you please take the work away? No, they're going to bite you even harder. Because what do you do when the vending machine doesn't work, when it's always worked before? You might shake it a little bit. You might even get a little upset. You might curse. Who knows? But you're not just going to be like, oh, I guess the vending machine doesn't work. Okay, that's rare. You're going to try something else. You might do something you've never done before. Now instead of biting, maybe now you're going to kick. Maybe now you're going to scream. And that's when you really have to be careful, because the behaviors are going to get worse in that moment. We always warn parents, if you really want to get rid of this behavior, be prepared. If it's a maladaptive, because it's going to get worse before it gets better. You may all of a sudden see a behavior you've never seen before. Timmy has never bit anyone. Now he's biting. Why? Well, because if slapping you across the face doesn't work, maybe biting you will. And that is when you need to be so careful. If what they wanted was a lollipop, please don't give them the lollipop after they now bit you. Because guess what? Now they've learned biting and slapping works to get lollipops. Now I got an extra behavior in my repertoire to get what I want. And that's the last thing you want. You want for them to get it through their heads. Oh, wait, so I kicked, I screamed, I did all this, it didn't work? Okay, I'm exhausted, I'm tired because, I'm trying everything that I can think of and it's not working. And all of a sudden, someone taps them behind them and says, you just gotta say, I want the lollipop. And they're like, well, might as well try it. And they say it. And then it's like the biggest thing in the world. Oh, you said you want a lollipop? Here you go. But, the next day they still might try to hit you and bite you. Because it's not gonna just be, that's it, it's gone. But if you stay consistent, and you're hitting, you're screaming. Oh, you said you want a lollipop? Here you go. And let's say you're doing that amazingly. Everyone's doing a great job. The parents are following through. You guys are following through. Then all of a sudden, 3 weeks later, there's a lollipop in sight. And instead of saying, I want a lollipop, he tries to bite you. Say, wait, what? But you know that doesn't work. Don't be surprised if that happens. Because spontaneous recovery, all of a sudden a behavior that was gone, that you're like, yes, we did that. We got rid of that maladaptive behavior. And we replaced it with, something that we want, verbal behavior. No, it'll randomly come up again. And that's when it's like the world is testing you as paras. They're testing you to say, do you remember what you're supposed to do when that client does that behavior? You have to always remember in the back of your head, okay, if they do this, this is what the BCBA said I had to do. And you just go back to it. And don't be surprised if, let's say, someone new comes into the house. Someone came to visit and they have a lollipop. And you know that with you, they're not going to try that. Because they know. They've been working with you for months. They know that when Miss Cindy comes over, you say in a nice voice with eye contact, can I have the lollipop, please? And it's beautiful. It works, right? Someone new comes in and no, I'm not going to use those words or anything. I'm going to go bite or I'm going to go scream. Because why not try? They're going to try that. So that's why everybody needs to be consistent. Everyone needs to be on board. You need to prep everybody. Hey, you have family coming over. Remember, tell them. We don't acknowledge biting. We don't do this. We don't do that. This is what we do. Because it just makes the work harder. And it does a disservice to the child if they're getting mixed messages. But again, the real world has some mixed messages. So we try our best to prepare our clients. Our environment is constantly changing. So you may notice, even, with your own children, that when mom is home, kids are different than when dad is home, or when cousins are there, or when the grandparents are there. It's a different environment. Different people allow different things. As much as we want consistency, our kids are very smart. They know, oh, you're here. I can take advantage of you. Oh, you're here. I gotta give full eye contact to get what I want. you'll see these kids that sometimes the parents are like, no eye contact for me. And yet, why is it that with the para, with you, I see that as soon as you walk in, hands folded, can I use the iPad, please? And it's like, wait, where is that child coming from? It's because, maybe the child knows, well, I don't need to do that with mom. I can look this way and said iPad, and I get the iPad. Kids will learn who they can do what with, just like we do. And we need to make the behaviors that we want to see the easiest behaviors. If you tell me, here is $100. All you have to do is say, I want $100. And then another person comes up to me and says, here is $100. All you have to do is clean all the toilets in all the houses on this block. And they both mean it. Why would I go to the one who's telling me to clean toilets when for this person, all I have to do is say, I want $100, please? You may be thinking then, but then why do our kids go through all these hoops and, all these tricks and stuff to try to get the things when all they have to do is use their words? Well, I'll tell you why. If this person on this side tells me, clean the toilets, and I clean the toilets, and I get my $100, and every time it's consistent, I get my $100 because I clean the toilets. But this person who tells me, just say I want $100, 2/3 of the time, they're like, oh, I don't have it. Maybe next time. There's a discrepancy there. I can't trust this person anymore. I'll rather go, even though it's more work, even though I'm exhausted by the end of it. Sometimes you see your clients and they're sweating by the end of their tantrums, but they got what they wanted at the end. Whereas sometimes, like I was saying before, a lot of times adults, they see good behavior and they kind of want to push for more. They're like, oh, you said you want a lollipop, but wait, let's do this work first. And again, that's the ideal. That's what we want to work towards. Because the real world isn't just give me $100 and here you go. But we got to get to that point first. Because remember, our kids have a history, a learning history of getting what they want however they're going to get it. And we're the ones here trying to shape that into appropriate behavior. So taking a completely step in a different direction, we'll talk for a few minutes about respondent behavior. It's the behaviors that you emit that no learning's required. Someone blows in your eye, no one needs to teach you blink. You're just going to do that. It's the behaviors that you see babies do, reflexes. Salivation at the smell of food. If your hand happens to touch something that's really hot and you pull it away, that happens on the very first time. No one had to teach you that. There was no learning curve there of, okay, maybe at the 4th time I'll learn to remove my hand away. It's just a reflex. Something that you do, it helps us survive. So that's respondent behavior. And then, operant behavior is, again, what we tend to focus on in ABA therapy and what you guys are doing. We adapt to our environment. So sometimes you'll notice a child goes to a new classroom and it's like they're a different child. Why? It's because maybe those people in that classroom, they don't know anything that, Johnny doesn't like to work. Or, no, don't even bother. No, these people have no idea about Johnny's, aggression or anything like that. So they just, okay, Johnny, it's time to work. When work is done, you get to use the computer just like everybody else. And sometimes these kids are like, oh, that's the rules here? Okay. Well, if that's the rule. And some kids are like that. Not every kid, but some kids are like that. It's the same way that when you see your own children or the clients you work with go to grandma's house or go to somebody else's house and they're very different. And you're like, well, why isn't he like that with me? Different environment. Different rules are in place. And then, reinforcement. Positive reinforcement, negative reinforcement. So I know for those of you who were at the last training, you guys already know that when you add something to the a stimulus is added following a behavior, and the likelihood that that behavior occurs again in the future is increased. That's how you know it was positive reinforcement. If I say I want a lollipop and you hand me a lollipop, if I like lollipops, the next time, I'm more likely to say, can I have a lollipop? Because I want that reinforcer. And negative reinforcement is removing something. I don't want to do this work, and you remove it. Oh, so saying I don't want to do this work, that's a good behavior. I'm going to use that one again. So if I say I don't want to do this work and the behavior is removed, then great. That's what we want. If I kick you, because before in the past that used to work, but now it doesn't, well, I'm not going to kick you because it doesn't work. I'd rather use what works. So examples of reinforcers: edibles, iPad time, break, verbal praise. Do any of you guys use edibles during your sessions? Is it okay to use edibles? Yeah, it's okay. Is it the preferred reinforcer? No. For example, let me tell you, my daughter, she is extremely stubborn. Extremely. This happened just a few days ago. She needed help, but she doesn't like talking. She really doesn't. She'd rather use sign language. She can speak now, but she doesn't like to. So she needed help turning her Kindle on. And I see her struggling. So I said, oh, do you need help? Fully aware that she can say, I need help. And that in the past, I have reinforced this. So she knows if she says, I need help, I will help her. However, she was being stubborn. So she literally screamed out, no, I don't say I need help. And she turned around and she's still trying furiously. She's getting really upset at this point. She's about to I'm afraid she's going to break the iPad. And I'm just like really? You use the words in telling me that you wouldn't use the words. I just had to wait it out though. And at one point she actually just kind of came to me, because at this point she realizes she can't do it on her own. She needs my help, but she still won't say, I need help. So she's nudging it at me. She's you're going to do this for me, right? You know what I need. I know I need help. That's what's going through her head, And I'm just when you're ready, say I need help. And you know that this child, it took her an hour to say it. And my heart's breaking on the inside, because I'm I know what she wants. I know what she needs. And the screaming that this child was doing, you have no idea how much I wanted to just be it's fixed. Here you go. Just stop screaming. Because she wasn't just there frustrated on her own. No, she was full on screaming because now she knows that I won't do what she wants. You got to have the patience. And I'm going to tell you this right now. My husband walked in and he heard the screaming, and he was, I could see it. He was coming to fix it. And I just said, no, do not do this. I just spent an hour making sure that this child would say it. And she eventually said it. And that was a battle that thankfully I won. And I want to see that she won too. Because while we may, I want to say coddle to her because, we're her parents. While we may be oh, okay, just stop crying, here you go. The whole world isn't going to do that. She's going to be in school, and, she's going to be outside with other kids. And they're not going to understand why is she being like that when she can just say what she wants. And she needs to learn. I'm not going to, adhere to that. No one else is either. But yes, kids can be stubborn. Very, very stubborn. All right. And use a variety of reinforcers. If you know that they like Skittles, bring a different bag one day, a different flavor. You'll be surprised. They might like that one too. Just to, change it up a little bit. And be descriptive in your praise. Don't just say, good job. Tell them what they did a good job at. Oh, good job matching the colors. Good job sitting. Good job, whatever it might be. It's important, especially because sometimes we have our kids who, they're very quick in their maladaptive behaviors. You'll tell them, do this, and they'll do it. But the next thing you know, they're also trying to hit you, even though they just did what you did, and you're good job, and you're oh wait, they just tried to hit me too. Be very careful that when you praise, You only praise if they did what you asked and nothing extra that was, maladaptive, because then that gets chained in. All of a sudden, I've had kids who think that do this means slap. And you'd be surprised, but it happens. And then you have to now teach the child, no, that's not what I meant. Just this. So, it sounds silly, but it happens. Especially some of these kids that they're really quick. When you guys are doing that, building rapport again means getting that kid to like you. Because that's important. You don't want to work with somebody that you don't like. So it's the same thing for them. So you don't want to place any demands at the beginning. You kind of just want to be like, yeah, I'm here. I am the one who gives you reinforcers. You may even come, if you speak to the parent or your BCBA beforehand and you know this child loves chocolate, your first day, you might want to bring some Hershey's, You might want to be like, oh, hey, I'm here to work with you. Here's Hershey. Don't even say you're here to work with them. Just sit down. Oh, I love Hershey's. Put one on the table. There's one for you if you like it. Don't even say take it. You just want to see, will they be with you? And something that's a way to know if you've built good rapport. How long are they able to stay with you before they run, before they leave? It's, you want them to want to be with you. And whatever they like, you love. If you know beforehand that your kid loves comic books, you're going to go in there and just look it up a little beforehand. And you'll be like, oh my God, I read this comic book the other day. It was about Iron Man. And then just see, do they start talking to you? There was a child that I recently saw, a 14-year-old. Everybody told me, don't be surprised if he ignores you the whole session. But they told me that he likes fashion. So I come in there, not giving me any eye contact. So I pull out my phone and I just start talking to myself. I'm just like, oh man, I gotta go buy something at the store. And he's really into high fashion, like, really expensive stuff. So I said, you know what? I think I'm gonna go to Target because they have that really good and immediately he looks up and he can't resist. And he says, Target? Are you, what? Target? And I'm like, Old Navy? And immediately he just because he couldn't, and sometimes you gotta just bring them in, and I'm talking again about our clients who are more verbal, who are higher functioning, but it's the same thing with the little kids. If there's a little kid who he's lining up his trains, get right there on the floor with them, line up trains too. What they love, you love. And then it's kind of like, oh, okay, well, this person can't be so bad because they like what I like. And then eventually you start showing them things that you like. And they might be like, oh, well, she likes trains and, airplanes. Airplanes might be cool too. And slowly you'll start expanding what they like. And you'll be surprised, but it can work. So going into pretty much the last stuff of this is promoting generalization and maintenance. You really want to be teaching across different exemplars. If I teach a child, this is a cat, and I present a picture, don't just teach this one picture. Teach several different pictures. Use a stuffed animal cat. Use a real cat. Use a cartoon picture of a cat. Use Garfield the cat. They should know that all these things are cats. Because a lot of times what we see is the BCBA will tell the therapist, okay, we're going to teach tacting, labeling, cat. And they give you one material, or they tell you, look it up on your phone, or whatever it might be. You show it, they mastered it, they learned it, great. Next thing you know, someone else shows them another picture, they have no idea what it is. Or they go to another house, there's actually a real cat there. And you say, what's that? They're looking at you like you have 3 heads, they don't know. And while we may feel, oh, we don't really have to teach this with, a lot of times typical kids, you don't have to teach that. They'll just pick it up, oh, cat, 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 that's a cat, that's not a cat, that weird looking thing, yeah, that's a cat. But with a lot of the other kids that we're working with, that we're getting used to, we have to try to teach. Actually sit there and say, this is a cat, bring a different picture next time, this is also a cat. Yeah, it's time consuming, but it's worth it. Because you want them to have all these skills. You also want them to maintain these things over time. Sometimes you'll work with a child and they know it today, they know it tomorrow, they know it the next day, and you're like, okay, great, it's mastered. Let me put this in the back of the binder, or we're not touching this program anymore. A month later, you come and you ask, and it's like, they look at you again like you have three heads, like we've done this before? And it's like they forgot. And that's why you want to just keep going. And yes, sometimes you'll continue teaching the same thing over and over and over again. And then you'll fade it out that we're only going to teach this twice a week. And not even really teach it. You're going to ask to see if they still know the right answer, because they should. You've been teaching this for all this time. And then you'll do once a week, then once a month, and then, once every 3 months. Things that I learned in high school, a lot of the math, I don't know it now, because you're not constantly doing that. That did not maintain. But addition maintained, because you keep doing that. Subtraction maintained. Reading has maintained. However, Italian, I took Italian in high school and college, but that has not maintained. I haven't practiced it. It's the same thing with our clients. You need to keep practicing, because if not, these skills will not maintain. And there are so many skills. So as you've been working with your students more and more time, you're going to have more and more to work with them, because everything you taught before is still going to be there. You shouldn't just be putting this away. You'll continue to bring those things up. And sometimes it's also motivating for them, because you're going to keep saying, great job, as opposed to a lot of error corrections or prompting for things that they don't know. Now it's mixed in with all these things that they do know. And I've seen kids go up to their mom and be like, ask me what my name is. And then they'll say it because they're so proud of themselves, because now they know it. And just one last thing before we go into the catalyst is just be very respectful and have dignity at all times for our clients. There are situations where if I'm going to go use the bathroom, no one's coming in with me to make sure I washed my hands or make sure I did things properly, because you respect my space, and yet we take it for granted. We go in with our clients all the time, and sometimes we have to, because we have to. But just be respectful and mindful of that. Whenever possible, start fading yourself out. Teach them to close the door. When possible. For some of our learners, it's not always, you have to take it on a case by case. If a child wets themselves, don't change them right there where they are with their siblings walking around. Because would you like that? If someone changed you and took your clothes off because they were wet, no, make that kind of a discreet, let's go to the room, let's go get your stuff. Because how would you feel? Especially in a school setting, you want to make sure that there's privacy, make sure that the doors are closed, so that especially if they can go to the bathroom independently on their own, teach them, when you go to the bathroom, close the door, or at least, shut it a little bit. And just smile. And if you're having a bad day, you're not having a bad day when you're in your session. You're just not, because they don't deserve that. All of you have probably had a situation where someone's interacted with you and you know that the person interacting with you had a horrible day and they're taking it out on you. And that kind of sours that relationship, because you're kind of like, what did I do to deserve that? And if you're like, well, nothing, then it's like, well, I'm not going to really want to interact with you. It's the same thing with our clients. If they notice, you're in a bad mood, or you're tired, or you're not as enthusiastic as they would like you to be, they're not going to want you there. So you have to be over the top. But again, case by case. Because I know some students that they're very bothered when I'm like, oh my goodness, that was awesome. And I had to instead be like, that was a really good job. You made me so proud. Because if I'm over the top like that, it really bothers them. And again, case by case, you'll get to know your clients. And just a few quick slides on Catalyst. Well, does anyone have any questions on Catalyst? Or any concerns, really? It's the data collection system that Applied uses. It's on the iPad. You can download it on the phone. You sign in with the PIN that the agency gives you. You click on the folder. If you have multiple clients, you'll see multiple folders there. You click on the one corresponding to the case that you're on at the moment. And your BCBA sets that up for you. You'll see the programs there. Sometimes they'll make a playlist for you, so that you'll know, when we're out in the community, this is the playlist for the community. And it'll have all the programs that you should run when you're there. Or there might be a bathroom playlist, so that we're going to do ADLs. All the programs are easily there set for you. And there's also behavior reduction data, where you can take frequency, duration of when things are occurring. What else is there? There's momentary time sampling, and all of these things are things that your BCBA will explain to you beforehand. Oh, hey, this is going to be there. This is how I want you to take the data on it. And as always, if there's ever a moment of doubt where you're not sure, what behavior am I taking data on? How should I be taking the data on it? The BCBAs, they come to the session sometimes. Have them show you. Don't be shy about saying, oh, can you run this for me? Show me, model it for me. I want to do it right. Let me watch you do it first. That's what we're there for, to show you guys how to do it. And you can compose notes on it. And that's pretty much, Catalyst is pretty straightforward. And if you have any questions, as always, you can call the agency or call the BCBAs. So any questions before we wrap up? Any last comments or anything? No? All right, so you guys were great. Thank you so much.
Thank you.